Hello and welcome to another episode of Ask a Nacogdoches. My name is Jeff Patterson, Chief Executive Officer for Nacogdoches Medical Center, and I'm here today with Dr. Rodolfo Oviedo, board certified in general surgery, as well as focused practice in metabolic surgery and robotics. Welcome.
Thank you, Mr. Patterson. It's a pleasure to be here. Thank you for welcoming me to the city and to the hospital and the community.
Well, it's great to have you here. Dr. Oviedo started in August, and one of the things that he brings to our facility and our community is an expertise in robotic surgery. Can you talk a little bit about the procedures you provide?
Absolutely. So robotic surgery or robotic assisted surgery is minimally invasive surgery, as you know, to the extreme, so that it resembles open surgery with all the advantages that surgeons would like to have with their open hands, but in a minimally invasive fashion. And that includes anything that can be done in the abdomen, on the abdominal wall, and other parts of the body. For example, bariatric metabolic surgery. That includes abdominal wall reconstruction for hernia repair. That includes anti-reflux surgery for heartburn, and so many other procedures for cancer as well.
So what are some of the advantages to patients who participate in minimally invasive and robotic surgery? You hear things about blood loss, return to work. What are some advantages?
Several advantages. I would say there are advantages for patients and also for surgeons, and we love those. For patients, the ones you mentioned, less bleeding, more control of structures, fine dissection, so you manipulate tissues less, you have less trauma to the tissues, so patients recover faster and better. At the same time, there are many advantages to the surgeon, especially control. We can control multiple mechanical arms at our disposal. We can control the camera, the optics are superior, we have 3D visualization. We have advanced instruments for stapling and energy. But above all, control and the ability to assist ourselves as surgeons so that the patient gets a better outcome and a safer outcome after the operation.
As medical director of our bariatrics program, we're going to pursue accreditation this year. What all does that entail?
It is a very rigorous process that at the end we will be able to achieve, hopefully within a year, and it involves accreditation by the MBSA QIP. That stands for Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. So it's a program formed by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery. They got together and they formed this important accreditation program that the most important centers in the United States and more than the US in North America follow the recommendations and guidelines by the MBSA QIP. That involves quality measures, it involves resources from the hospital and the community to take care of patients with complications if they happen to occur. It involves data registry, the identified information to make sure that we all get better with quality control, as well as research and education resources for patients. So it means that once we achieve that goal, we will be among the top centers in North America for bariatric and metabolic surgery.
We're so glad to have you here, and we're so excited about pursuing this program. Tell me a little bit about your family. I know you moved here from Houston just 2 months ago.
Yeah, so we're very happy to be here. I am happily married to my wife of almost 10 years. And our 3 sons, 3 little boys, 6, 4, and 2 years old, moved from Houston, from the greater Houston area. We're very happy here. We're enjoying living in the community, getting to know the city. We have already made friends, so everybody's been very welcoming to us, so we're blessed to be here.
Thank you, Dr. Oviedo, and thank you so much for joining us again for another episode of Ask a Nacogdoches. See you next time.